Safe Space with Shay. I am so glad to be back in front of a camera, live and in color, transitioning from audio to on screen. So I want to thank you guys so much for supporting me all the way up until this point. I am so excited today to have my first official guest, on-screen guest, Dr. Danielle Hairston. She is a board-certified psychiatrist, and today we are going to be talking about racism and mental health. Dr. Hairston, can you introduce yourself?
So let me say thank you, Shay, for having me here. It's exciting to be here, and I love what you do. I hope we get to talk more about why you decided to do this podcast and why it was important. But yes, my name is Danielle Hairston, doctor, a doctor named Danny on the socials, and I am the Psychiatry Residency Program Director at the real HU, Howard University in Washington, D.C. I'm a Consultation-Liaison and an emergency psychiatrist, so I see people in their worst of worst situations, and I also teach and research and write about racism in psychiatry, racism in mental health, and that's what I have dedicated my career to, early career to thus far.
Love it. And you know, your work is so necessary and so needed. So I appreciate all the work you do and your commitment to mental health, especially in the Black community.
For that, I do what I can.
Yes, for sure. So I want to dive in, as far as understanding the origins of racism in mental health and the history and how it was historically and how it is today.
How much time do we have? Because that's a whole course, a whole book. So speaking of books, I'm a contributing author to the book Racism in Psychiatry. Came out in 2019. We're about to do a revamp and make a second edition later this year, or maybe early next year. But that's how much we really have to talk about a whole book. And I was one of the authors who worked on the origin. So if we take it back to the times of chattel slavery and enslaved people, and I really work to say enslaved people and not slaves, and not defining people as what they went through. The same thing as not defining people as their diagnosis. So back then, we went through a lot of trauma. People had to endure all types of things, and they had to really survive. So how do I survive in a situation where I'm not allowed to express my feelings, where I'm not allowed to say I'm sad, I'm not allowed to say I'm having a bad day, I can't call out, I can't have a sick day from being enslaved? How do I move through this? How do I survive? So what we saw was a lot of silencing of your emotions, silencing of your feelings, pretending to be happy, putting a smiling face on, like shucking and jiving, if you will, to survive. So we see for generations that survival tactic was passed down of not talking about your mental health, not talking about what you're dealing with, not putting your business out in the streets, not letting people know what's going on with you. So people talk about this stigma in the Black community and say, oh, Black people don't want to talk about this. No, Black people couldn't talk about this so that they could survive and make it through. So that survival tactic is passed down. So we then come to the time when slavery is ending, supposedly, the traditional slavery is ending. And, these people, colonizers, enslavers, they were in this for the long game, right? For the long run. Like, they knew that they would have to make different moves. So, yes, some people went into law enforcement. Some people went into the legal system, yes, but some people went into mental health. Some people went into medicine. And that's why we see racism is also embedded in every fiber of this country's medical system.
That is so good, though, and I really appreciate you saying that. And it just makes me put into perspective some of the things that I'm doing. So I've been doing mental health and wellness pop-ups throughout the city. Okay. And so I'm providing education on mental health. What do these mental illnesses look like? Grief, what does that look like? Trauma, depression, PTSD, CPTSD. I mean, it's so much that I feel like our community is bogged down with. And I feel like educating is the first piece of that, right? Giving them the knowledge to identify and see themselves within these diagnoses. So it's just so important for me to put that out there to help normalize it. Because like you said, as Black people, we weren't seen as human. We just were in this survival mode. And in these spaces where you have these people with these very narrow perspectives of Black people not giving us the proper care, it's important that we come in there and be empowered to speak up, question the doctors, ask specific questions about certain things you're experiencing. So that leads me to my next question is how often does misdiagnosis, underdiagnosis, not being diagnosed happen?
All the time. So, and that goes back to, speaking of education, I believe in Sankofa. So you can't go forward without understanding where you came from, that principle. So, yeah, it's been going on forever and it was intentional. Like this was a plan. It was something that was put into place. So like I said, when slavery ended, it was, okay, we can't enslave these people anymore. What can we do? What kind of future enslavement can we do? So we can put them in the carceral system. So we can make sure that they're arrested, that they're imprisoned for various things. Okay, that's one way. What else can we do? Institutionalization. So we can put them into mental hospitals. We can say that they're insane, and we can have all these asylums across the country, and just for Black people or for colored people. And what diagnosis are they going to have? Well, if they think they should be free, if they want rights, drapetomania is one that they came up with. Like, oh, something must be, you must be insane if you want to be freed from being enslaved. You must be insane. You must have a mental problem if you think that you should be out of this situation, if you think you deserve to be liberated and free. So we can enslave you for that. And we can institutionalize you for that. So what else can we do? When it ended, you can be put into a mental institution for vagrancy. Now imagine this, right? Slavery ends, you're free in this sense, You're free. But you have nothing. You have nowhere to stay now. You have no means of employment. You literally don't have any food or anything or a way to provide for your family yourself. So you might be just outside because what else can I do? You could be institutionalized. You can say that people can say you have a mental problem and you need to be put into a mental asylum because you're outside for being vagrant. So you can be literally kind of like what's happening now, homelessness. Yes. So you're homeless, you can be forced into, so like I said, it's a long game, right? You can be forced into psychiatric treatment and things like that. So if that's the foundation of where we came from, you can understand how there's all types of misdiagnosis and whether it's an accident or just missed. What we see a lot is overdiagnosis of Black men with schizophrenia. That's some work that I do a lot. Overvaluing psychotic symptoms instead of recognizing and asking about mood symptoms. So say a patient comes in and says, oh, I was hearing voices. Oh, you were hearing voices? You're a Black man? You must have schizophrenia. Not asking further questions like, I was hearing voices in this context. Like the voice I was hearing was of my grandmother, or I feel like she was talking to me. She passed away recently. I'm going through some grief. I'm going through complex grief. Or, all right, I was hearing voices, but also I was smoking a little weed. Maybe you didn't really ask me about that. Maybe smoking a little weed, maybe smoking a little crack, whatever it was, but there was substance. Like, did you ask further? Like, was I using a substance? Was I also traumatized? Was something going on? Like, I felt like I was hearing this, but that was really just a flashback from trauma that I endured being a Black person, and not just in adults, also in children. A lot of children are diagnosed with ADHD, with these bad kid diagnoses like conduct disorder, but you're missing the trauma. You're missing that this child might have gone through neglect, might have gone through any type of abuse. They might have anxiety. They might not even be able to hear. Like, hearing tests are very important for behavior acting out for Black children. So a lot of times we see misdiagnosis there when they're going through anxiety, PTSD, depression as Black children, but they're automatically labeled as bad kids and get these conduct disorder, oppositional defiant disorder diagnoses. But every child's acting out is because of some unmet need or something that's going on. So one of my great mentors, Dr. Alpha Stewart, who used to be the president of the American Psychiatric Association, the first Black one, took 135 years, but that's another story, another episode. She says, first you need to ask what happened to a child instead of what's wrong with them.
Ooh, that's
so Yeah, those are just some examples. That was a long answer.
No, but I love
a very
that.
long answer on the misdiagnosis or overdiagnosis that we see in the Black community.
Oh my God, I so love that. So do you see like it changing in the medical field with the doctors? They say culturally competent. Do you see that being like culturally competent doctors being trained, right, on the patients that they serve? Do you see that being implemented? Or
I see I see cultural competency training being implemented, but like a checkbox, like, okay, yes, we checked this, we did this, did you do this? But implemented is a different question or issue. And I also don't like the term cultural competency, because how can you actually be competent in a person's or a people's culture? Like, it should be, if you think I'm an expert, if I'm considered an expert in the field, cultural appreciation, cultural humility, like understanding that you come from a different culture, something else is going on here. Okay. Cultural, I don't know, accountability, like all these things, like understanding that this is something that happens. We're not a monolith, but this is something that we can see, and understanding that people may not present in the way that you expect them to present, or they might not even be willing to approach and discuss things with you because of various things in their culture and things that have been going on. So, cultural competency, I'm gonna put a pin in that. I'm gonna say that I do see, in some ways, like especially in the time of George Floyd, like we saw some change, right? There was a whole like explosion of people being interested. And like back in 2020, 2021, I got lots of consults because people wanted to hear about racism and psychiatry and how we can change. How can I change my curriculum? They hired me as a consultant. But then I guess racism ended. Just playing. But then, a few years later, and even where we are now, that started to fizzle out. And now we have this whole anti-DEI movement, literally, from the bureaucracy, from the federal government, like taking away people's funding for grants, for things like that. So even if there was some move forward, now I see that it's going backwards, because if I can't even discuss this in my curriculum, if you try to take funding away, if people put in their grants like the terms disparities or diversity or inclusion or equity, I can't say that. What can I say to get these funding? Marginalized, minoritized, you get your funding taken away for saying things like that. So how can you effectively move forward if you're not even able to get the funding and resources that you need to have grants and research and teach things like that? So I don't know what the answer is for that. Have we seen steps forward? Yes, but we've seen so many steps backwards in the last year to 18 months. I guess we just have to see what's going to happen.
Yeah, and hearing that, I'm not gonna lie, it can be so discouraging. It's so heavy. How do we build a resilience, I guess, around that, to kind of like, you see these fundings being taken, you see reduction in a lot of things, like, what's the best approach? Is it a community effort?
Yes. Community. Okay. Empowerment, that's all important. I think that we are now in silos, like, I'm doing this over here, I'm doing this over here, I'm doing this over here, but you don't really know what's happening, and we don't come together like as a united force. And that's challenging, right? Because at this time you would think we would be able to come together with social media, connecting with WhatsApp, with GroupMe's, like you would think that you're able to make these connections, but I still feel like in our community, there's a separation. There used to be so much community, right? Like there used to be, oh, if I need a dentist, your friend is like, oh, I went to this Black dentist, they're wonderful, go to this person. Now it's, well, I'll see, I'll just Google. And that's where I go. That's where I'm going. Google what's closest to my house, a dentist within 1 mile. Versus the community that we used to see, like community taking care of each other. So I think a community approach is important, but also understanding that I am a psychiatrist, I'm an MD, yes, I went to medical school, all of that. Yes, I write you a prescription, that helps. But a prescription does not give you a social network and social support. A prescription does not give you the keys to a house, does not help you with being unhoused. So we have to understand that, yes, medication, I'm a proponent of medication. Obviously, I'm a physician and I write medication and pills. Yes, there are medications. Yes, and what else? Like, you need for further things. So I think understanding that, yes, whatever it is, if it's a healing circle, group therapy, whatever it is, yes, a sound bath. If going to a party, if you're going to carnival, if you're going to a twerk out, whatever it is, yes, like coming together for some joy, for some happiness, reaching out and building these things. I love to see when like Black people in the community are, especially like Black men who have groups for Black men's mental health and podcasts. I know everybody has a podcast, but like a Black men's mental health podcast is important so people don't feel alone, and you know that there are people out here who feel the same things, who are on your same vibe and need the support and are here.
I love that. Oh my God, I just think, that's so key and so important. And I like to see like the imaging now, even, on Instagram, I see Black people prioritizing rest, prioritizing joy. It's like an act of resistance. And I love that. I love to see that because so many times, we're stressed, we're burnt out, we're going through all of the things. And, it can just be really challenging to kind of really tap into that rest and that joy,
Yeah. I'm still struggling with that myself, but Rest is Resistance is a good book. They're also like, oh my gosh, I have to insert. There are cards that promote. I have the box and how to do like I don't know. For rest, I think that we have to understand, and this is something I also have to understand for myself, that no days off like is not a flex. Like no, like no days off, I'm gonna sleep when I die. Like, no, get that out of here. Like that's not helping us. It's not helping you as an individual, and that's not helping for other people to think this is something I need to attain. And I think for myself now, I'm like, how can I really live my best life on my own terms for me and my child? Like, how can I do that on my own terms and be rested and to do the things that I care about? So it's going to be a whole shift that we have to get into. Because like I said, that even leads back to what I said about like enslavement and chattel slavery. Like, you work. You work. And that's how you get to where you need to be. But also you can rest and you can relax and you can go to therapy and you can go to a sound bath, I used to be so like not here for yoga. But then I went to like hip hop or trap yoga, and I'm like, okay. Like whatever it is that you need for yourself, your own centering, like within your community, because now I love it that there are Black people doing all types of things. Like there are Black people doing sound therapy, sound bowls, like all of the things. I know a guy who does, like, back in Baltimore, who does sound therapy healing with the Afro beats. In Houston too, like Afro beats, hip hop vibe. Like, it doesn't have to be. We are a very innovative people. Like, we know how to do things. That's why people always try to copy. And imitate. That's right. Like, we know how to do these things, and I just want us to learn how to prioritize and uplift them in the community, because all healing is not happening in a psychiatrist's office. It's not all happening in the emergency room where I went, like that, where I work. That's like a few 20, 30 minutes, an hour interaction. Yes, for me to think of some type of what can I do to help, like what intervention am I going to put in now, but had other things been in place before, and if they can be in place in the community after, what else can be done? Because this 20, 30, 40 minutes, maybe 60 minutes, that's all, and I'm billing, is gonna be one thing, but what do I need afterwards? So I always ask, like when I see patients in the emergency room, like, who is your support? Like, who can I call? And the worst thing is when they say, I have no one.
I'm glad you brought that up too, because I will say, I know a lot of families they find it challenging to support a loved one who may be schizophrenic or may have bipolar. It can be so unpredictable. PTSD, like, what advice or suggestions would you give to maybe the family member, or because I feel like the individual they already are battling with this illness, and so it's hard for them So not having that support can even be more challenging. And, you know, a lot of them, I just can't deal with it. It's too much. What would you implore them to at least attempt to do to support?
Well, first it's tough, so I got to give the family members some grace. Like, it's tough. And I know even when I see family members come into like inpatient psychiatry and they're like, I can't do this. And I think when I was younger in my training, like early as like an intern or resident, I used to be like, how can you just leave your family? Like, how can you do this? But to understand like also the impact on them, like living with someone who has a mental health issue or a psychiatric diagnosis, especially SMI, a serious mental illness like schizophrenia or bipolar disorder, like not this the unpredictability and going through that, like that weighs on them. So I think for them, it's important that they are also in their own type of treatment, like their own therapy or group therapy, and also NAMI, like NAMI. NAMI is wonderful for resources for people who have loved ones who've been diagnosed with psychiatric diagnosis. They have ones for like children. I think they want to have ones for parents, and just families in general. So support is out there for you. But I think a lot of times you feel like, how am I supposed to get out of this? Like, I'm going through this alone. Like, it's good to know, even if sometimes you just need to vent, and it's like, or ask people, like, have you ever, like, do you know what to do about this? Like, how can, or do you not know? Like, because sometimes, like, you know, like I said, social media is great. I'm not a social media hater. I'm on social media, but yes, but just like making a post, like you might not get the same effect as you would if like you're in a group. Like if you go to a NAMI group, if you're in a group text or something, like, does anyone know how to deal with this? Or does anyone know how I get resources in Detroit, or how I get resources in New Orleans or in Baltimore or DC? So having those people to reach out to. And also, like I said, I've even going through it with a family member who has a psychiatric diagnosis now, like, it's like, I just feel like you feel like overwhelmed. And you just want someone to talk to. Because even like when you go see the doctor can be like, oh yeah, I understand that stuff. Bye. I mean, you know, but what is there further? So I know that there is some funding to support like caregivers, and that's important. There's like some caregiver grants, like give you like respite or whatever, like they will provide like, oh, I will give this, like, you know, like you might get 80 hours a year or something that a caregiver will help you or give you a break so you can just go and do something. But I think that those programs aren't that publicized and just don't really exist. They're like, you know, few and far between. So that's really where we need assistance for anybody who has some philanthropic goals out here who want to give some funds. Like, family members really need that support and that break.
I love that. Yeah, that's so important. And now that's something that I think I want to have on my resource table when I'm doing my mental health and wellness pop-ups, because I'm always looking for more to add. I want to add value and just support for those who come by and take, you know, some of my resources. Because like I said, it's just so important. And the spaces that I go into are often like local coffee shops or, you know, different parks, like things that people are like, oh my gosh, like, oh, someone like you is out here. Absolutely. And they're really pleased to see, you know, this information is out here. So I think, you know, it's adding value for sure.
How do you choose where you go? Like, do you just wake up and you're like, I'm going to go to insert Black-owned coffee shop in Detroit that I don't know about yet, that I hope to go to one day?
Yeah, that's always my aim, is to go for Black-owned businesses, network with them, and just show up and be in community. I think that's important to be seen, especially just not where you would typically expect this information to be presented. So I was grateful enough to be able to, you know, be at some local coffee shops here, you know, Rosa in our Northwest Detroit neighborhood, Cafe Noir, that's in our Midtown area, Griffin's Garden, just a like beautiful garden. I went to school with Marilyn. She bought like different blocks and she just built a beautiful garden. So that's awesome. She has her summer Saturdays. So I try to be intentional with, you know, where I go and how I show up.
Well, you know, only my second time in Detroit. I'm trying to learn.
Learn
the things.
I definitely have to let you know some spots to check out for sure. Yeah. So what do you find most fulfilling about your work?
Oh man. Well, I think one of my residents asked me this earlier this week. He was like, "Why do you like academics? Like, why do you like teaching? Like, because you could obviously go and make a lot more money and do like, why do you want to do this?" But I think it's fulfilling for me to train and teach and educate the next set of psychiatrists, the next set of medical students who will soon be physicians, even if they don't choose psychiatry, but they are coming in with like and knowledge and knowing like, consider this, no matter what specialty you're going into, consider this, think about this. And I think really for training, predominantly at Howard, Black, predominantly now, Black psychiatrists. I think just seeing them grow and mentoring them and educating them. And like when I see them go from like an intern, like, well, why did you do that? To now I see them as a fourth year who are like, yes, this is how you do this. And yes, they can teach that. I think the growth is what's very like encouraging to me. And that's what keeps me going. Like they keep me on my toes. Like, what about this? What about this? I read this. Like, I think that's very, again, maybe that's also a sense of community that's very different than like, no shade to this group I'm about to say, but it's very different than for like an outpatient psychiatrist, private practice where you're just like practicing here without like the, again, community and networking. Then I think I get to see them every day and teach them, students on my service, even when I have like, even the undergrads who are interested, I'm like, okay, an undergrad already coming in saying they think they want to be a psychiatrist. Like that's amazing. So that's fulfilling for me. Also, I have, a youth mental health project grant that I'm working on through Hope Lab I plan retreats. So I guess that's very fulfilling to me because, you know, I'm always outside, somewhere. Like when I say outside, I mean out the country. Right. My outside. Nice. Like, the fresh air I need is not U.S. air. When I say I need some fresh air, but it's creating like restorative spaces, for Black physicians, Black psychiatrists. And now I'm working, hopefully, on learning how to do that for youth, for Black and brown youth, to create a virtual retreat space. And then also, well, it's going to be hybrid, also bringing them together eventually, to see if I can improve their mental health, improve their thoughts about psychiatrists and what a psychiatrist is, maybe encourage them to go into some path in mental health, psychiatry, psychology, counseling, therapist, whatever. So again, I guess it always comes back to is like, I just like to see people win, and that makes me feel better. And I'm ready to go into early retirement. So I'm ready for them to take over and be the next wave of psychiatrists, mental health providers out there.
I love that. And it's so important and it's so key because when you talked about the next generation, I thought about, you know, there's such a small percentage of Black medical doctors, psychiatrists, and just kind of really boosting that up is so necessary and so important, especially when I feel like now this younger generation, they're coming in talking about mental health like their physical health. Like they have no problem with
what we need.
We
need the right way though, because, you know, I see some things on like TikTok. Like I think there was a trend like this week and last week, like, well, my therapist said, but your therapist is really ChatGPT. Okay, ChatGPT is not going to be your therapist.
There you go.
Everybody, like, I do love to understand VR and AI and how that can help. But therapy is therapy, like actual trained people. So, but I do like the new generations or the younger generations because I'm a millennial. Elder millennial, I think. But I do like the ones after us who like start talking about their mental health, and mine always taking a mental health day. So, but I do appreciate that the conversation is more open now, and I've seen that shift for sure, and I like that.
Yeah, for sure, and that's especially across the generation because I'm a millennial as well, and my parents are boomers. So, like my generation and their generation, it can be a little, you know. But I do feel like they are more open to having a conversation now too. They got grandkids that's like when they ask questions and kind of, you know, just know more. So I think that also helps because I don't know. It just seems like with the grandkids, they're a little bit more welcoming versus when it's their kids.
Definitely.
So it's important. So I do like to see that change and just the normalcy in it all. So yes, it's important for sure. Yes. Well, I think I asked all my questions. Oh, I didn't ask though, what made you choose psychiatry?
Oh man, someone asked me that today earlier. That was the only rotation I liked in medical school.
Okay.
Like surgery was not for me. Not standing, like waking up 4:00, rounding, standing over, like no. There was OBGYN, and shout out to all my colleagues who do all that work. No, but psychiatry was, and I think the specific psychiatry that I do, I was always interested in medical school, was doing consults and like mixing psychiatry and medicine, like understanding the intersection between that, like understanding that you can't take care of your physical needs if you still have your mental health and your psychiatric conditions going. Like, how can you expect someone to take care of their diabetes or high blood pressure if they're so depressed they're not even able to get out the bed and remember to take a medication? Or even knowing that like hyperthyroidism might make you seem like you are psychotic or seem like you're manic and having mood swings, but it's stuff that people miss because they're not checking what's going on. So I love the intersection specifically between medicine and psychiatry. Well, psychiatry is medicine, but understanding how it manifests and how it presents. So I always like that. So it was a little, I was like, do I want to do internal medicine? Do I want to do, I don't know, but I'm happy that I ultimately chose psychiatry with the medicine, on the side or in between.
Yeah, I love that though. And I'm glad you said that too, because I think a lot of times too, people look at mental health and physical health as different, but they are like,
they're the same.
Yes.
Like,
so it's like physical doctors I feel like they need to start asking more questions. Like, okay, if your patient is coming in complaining about something X, okay, have you been stressed? Are you just, and be like open to say, okay, well, have you considered talking to a professional? It's like, I don't know. I guess that's changing now, but I think historically it's just,
I think sometimes people still are afraid about, like, if they do say they do have this, then what's my next step? And especially when we live and work in a time of you got to get your appointment done in this amount of time, you got to do this has to be turned in. Like, oh my God, if they now say they are, oh, by the way, yes, I am depressed. Like, oh Lord, now I got to ask for further questions about that. That's going to put me behind and all the types of things. So I think that we are seeing the change, and it's fine. Like, you're like, you know what? I can't talk to you about that, but let me refer you to psych, which happens. And I, honestly, that's how I get my patients through consult. So I'm happy to consult. I'm happy to come in and liaise and assist. But it starts with really asking the question. But you have to have a plan for when you ask that question. What's the next step?
Yeah, for sure. This is so true. And it's just so important. So then my last question, what's your takeaways? What do you want my audience to take away from our conversation we had today?
Oh my goodness. Let's see.
I know we talked about so much, but
okay. First, I want your audience to understand that things are generational. Like, the things that you see today that are presenting here might go back to your parents, to other people in the community, grandparents, great-great-grandparents. Like, you have to understand that the person you see in front of you is just a small picture, a snippet of their entire life, their family's life, their experiences, their community's lives. So understand that there's no quick fix. Like, there's not going to be an answer like, oh, you just need to take this medication, boom, you're done. Like, you need to take this medication, and I think that the next step is really important. Like, I got y'all and we psychiatrists and physicians, because primary care sees more mental health diagnoses and psychiatric diagnoses than even we do as first. But understand that, remember and take home that yes, there's this, but what else? Like, what else can be done? And not putting all the weight on just one person or a family, but what else can be done to support each other, I think is what.
I love that. And I hope you guys have taken away some valuable gems that we dropped here today. I want you to always know that you are worthy, you are deserving, and I hope that you are honoring yourselves. Until next time, bye.